Good afternoon. Welcome to the Convergence Science Network Women in Biomedicine panel. My name is Katrina Nguyen Robertson, and I'm a Science Communications Officer with the Convergence Science Network. Thank you very much for bearing with us through these technical issues. We're here now, and we're excited to be talking to you. It's a little ironic that we're talking all about sort of the future of biomedicine and biotechnology, and we had some technical difficulties, but we are keen to chat to you today. Before we begin, though, I would like to acknowledge the traditional custodians of the lands on which many of us may be streaming from different lands, but I am currently on the lands of the Bunurong people of the Kulin Nation, and I pay my respects to their elders past and present. And I think when we talk about science, it's important that we remember that they are the first scientists of this land, and they've been learning for tens of thousands of years by observing and gathering that knowledge and accumulating that knowledge over time. So today we are talking about science, and the talents of women in science, technology, engineering and mathematics, or STEM, are vital to the future of Australia and indeed the entire world. Yet it's no secret that women are poorly represented in different STEM fields and the STEM workforce. So this Convergent Science Network event, and particularly this series, the Women in Biomedicine series, aims to really profile the amazing careers of wonderful women who have already made it in biomedicine, and we celebrate their successes and also talk a little bit about their journeys. So we'll kick off the conversation. I'll invite you to ask questions later as well, so you can ask questions as comments, and I will pass them through to our two speakers. But let me introduce them to you. Our two speakers today are Professors Megan Munsie and Professor Susie Nilsson, two absolute pioneers in the fields of stem cell research. So Professor Megan Munsie leads research programs into ethical, legal and social implications of stem cell research at the University of Melbourne, the Murdoch Children's Research Institute, and Renew, the Novo Nordisk Foundation Center for Stem Cell Medicine. She is also the president of the Australasian Society for Stem Cell Research and is a total powerhouse. She has influenced national and international policies and develops educational resources as well. So I'm very excited to talk to Megan today. And I'm also excited to talk to our other speaker, Professor Susie Nilsson, the Research Director for Biomedical Manufacturing Program with CSIRO. And she endeavours to understand hematopoiesis, blood cell production in the bone marrow, to improve human health, particularly in the areas of bone marrow transplant, stem cell mobilization, hematopoietic disorders such as leukemia and bone marrow failure. And her current role involves overseeing various clinical trials, and recently she was also awarded the 2023 Melbourne Network Inspiring Women's Leadership Award. So now I'm going to hand over to them. We're here to hear from them. So I might just ask my first question.
Okay, now I can see.
So we had a little bit of a chat about this before, but some people view science as something that's conducted using laboratory experiments and things like that. And you've been there, you've done that, and you've moved more into policy, advocacy and ethics. But you're still a scientist. You're definitely still a scientist. But what does researching stem cell ethics and policy actually involve?
So hi, everybody. Thanks very much for inviting me. I'm really delighted to be here today. It's such a great topic, and I'm really pleased to be here with Susie and with Kat. So for me, a lot of my work now is very much desk-based. So I work in a dry lab. But what I think is really exciting about what I do is it still has very much scientific principles. So I do a lot of work around analysis of policies and comparing Australia's policies with those overseas. I also do a lot of work with colleagues from different disciplines where we use different methodologies to perhaps capture patient and community perspectives, to interrogate those, to understand what the drivers are, the sociocultural drivers, and to really do, I suppose, a different type of research to, again, gather data. So the basic principles are still there, Kat, in terms of scientific investigation, but a slightly different methodology and certainly different methods that I ever thought I would use when I kind of originally trained as a laboratory researcher.
Yeah, absolutely. That's why I said, you're still a scientist. You're still using those basic skills. But when I read out your bio, you seem to have multiple positions. How do you juggle them all?
Oh, well, I think you're a multitasker by definition. I think, I suppose I do it through opportunity. So I find it very hard to say no, which I probably need to exercise a little bit more. But I'm curious. So I find it really hard to say, to kind of close down a conversation or opportunity. And I suppose my juggle is the priority. So I have a list, and, obviously things go on the top of the list that are really super important with deadlines. But, I just try to keep it all like a series of spinning plates, really, going all the time. And it just takes a bit of a juggle. But I also would say that I don't do it on my own. So I do my work with a whole lot of fabulous colleagues, and they help me keep those plates spinning.
Yeah, absolutely. Certainly saying no is something that I need to learn how to do as well. But, multitasking, right? So, Susie, you also do a lot of juggling in terms of various projects that you're involved with, and you have many clinical trials that are underway, plus building the new National Vaccine and Therapeutics Laboratory, among other things. Would you mind giving us a bit of a brief overview about the sorts of things that you do in your role?
Oh.
So, do you want to try saying something again? You might be frozen. Or perhaps we might need a different microphone.
I did hear Susie before.
Yeah. So maybe we'll let Susie work out those microphone issues. So I might just ask another question to Megan. Just in terms of all of that juggling that you do, on a day-to-day basis, what is it that you are actually doing? Maybe.
Well, I suppose every day brings a new joy, and perhaps a new challenge. But I suppose I do a lot of communication. So whether it's written, pick up the phone and talk to people, write submissions, write a paper. So a lot of it is thinking through and trying to be clear on my position on certain issues, the analysis of the data. But I do an enormous number of meetings. And you mentioned before that I'm working now in this fantastic transglobal research initiative through Renew. And so a lot of my evenings are now actually meetings with my students and colleagues in Denmark and in the Netherlands. But I think that brings with it so much other kind of joy. So it's a varied work space. I think the other thing I still do a lot of is speak to my colleagues who work in laboratory research. So I'm not sort of in my office stuck here, always just sort of doing my own work. I try very much to be out, whether it's out in the community, but also out into the laboratories to see what the latest research is as well.
Wonderful. All right. So I think Susie might be back. Hello.
Testing.
Yay!
Hey. Thank you for holding the fort. So
Can,
Susie,
can I quit now while I'm well behind?
So would you like to share a little bit about what you do in your role, Susie?
I try to work out audio visual logging in and computer problems. No, I'm kidding. What do I do in my role? I just wanted to correct just something that you mentioned before, Katrina. We don't actually do clinical trials. We make products that go into phase 1 clinical trials, so we enable other people to run them. We don't actually do them ourselves. I just think that's an important thing to correct. But
yes,
what
absolutely.
do I do in my day-to-day life? I guess I head up a program of about 150 researchers that span a very broad area of science, from basic chemistry to basic biology and everything in between. And we do work from very basic research all the way through to translational research. So what do I do day to day? I attend a lot of meetings. I get out there and talk to a lot of people about what we can do and how we can do it. And really explore how we can help others achieve their scientific goals by enabling them to move their product along the pipeline.
Yeah, and I sort of had a little bit of a look into this, so apologies for kind of misunderstanding. But yeah, a lot of what you are doing is setting other people up for trials, and I think I read that you were producing bacterial systems and mammalian systems and lots and lots of different systems that other people can use. So how do you work out what it is that other researchers need?
So 99% of the time, other researchers will come to us and say they've got this scientific problem and can we get some assistance to solve that? And we can work with them either to solve a very specific problem or to develop an entire project and move that along the pipeline. So we work with external parties in any way you can imagine, and we do very small things and very large things. On top of that, we do some of our own internal research where we're trying to develop capabilities to build on what we have to enable us to solve some of the country's most challenging scientific problems in this space.
And I wanted to know what drew both of you to the areas that you're in. Megan, you were talking about, the fact that you work here by day and then you've got meetings by night. So you must love what you do. So what drew you both to this research and this area? Perhaps Susie, we'll start with you and then we'll go to Megan.
So my background, and Megan and I have worked together for a long period of time, many moons ago, is in stem cell research for your blood stem cells. So I guess when I did my undergrad, what drew me to the stem cell area was really wanting to be able to change things to help people. I wanted to see something that I could work on actually have a real impact in changing the lives of people. And understanding your blood system and the environment in which the stem cells live in and how that then influences the stem cells, when to give rise to what type of blood cell, and how that went wrong in diseases such as leukemia really excited me, and it allowed me to feel that I could do something that was going to have a real life impact. And I guess I've followed that passion all the way through, and even to today where I'm in the role as a research director, where I can see the things that we do and work on every day having real life impacts.
Yeah, thank you. And Megan, you're also into stem cells.
I certainly am, and have been into stem cells for many decades now. But I suppose like Susie, I've always been really interested in sort of, I suppose, impactful research, so translational research. And I started my career really working in IVF, where I was fascinated by biology, but I was also very intrigued on sort of new technologies and how new technologies could be used. And so I went from sort of IVF into the then very new field of stem cell or pluripotent stem cell biology. This was before we discovered human embryonic stem cells, and we were using some mouse work. And my PhD was sort of looking at pluripotency in a bit more detail and using a quite an innovative technique back then around using cloning technology. And so it was a very much a sort of a fundamental research project with perhaps aspirations towards translation. But what I think happened around the time I finished my PhD was I was also really struck by how my work was subject to so much community discourse, and often from perspectives that I either didn't agree with or hadn't thought of. And so I really wanted to get involved in that. And I think if I think back through my entire career, not just my PhD and my work around sort of what is now called therapeutic cloning, but even my IVF work, I was always the one who wanted to kind of, I suppose, tackle those thorny issues. So if somebody rang up or there was a heated debate in the tea room, or we were being asked to perhaps do a public forum or something, I was always the one to put my hand up. And I think that challenge of demystifying a science, of perhaps not being hesitant to talk about the science, its implications, its challenges as well as its promise, has been something that's really been a continuum through my career. And what I can now do with the help, as I mentioned, with my sort of interdisciplinary colleagues, is apply different lenses and different ways of exploring some of these issues, but really very much through a kind of how do we strike the balance? So sort of the thorny issues that our field raises, that I know cause some angst in the community, I want to talk about it. I want to know more about where those issues come from, and I want to make sure that people are also perhaps focusing on what is the genuine science and not what's a, I don't know, science fiction interpretation of what we do.
And I think science communication is becoming more and more important. It was always important, but I think people are really latching on to the value and the importance of it. And as you touched on, stem cells, IVF, like a lot of what you've researched and been involved with throughout your career has kind of raised controversial issues for the wider society. So how do you go about communicating or conveying your science to people who might be not so receptive?
Well, I think the first thing is to pick up the phone and to answer those questions, to listen. I think listening is completely underrated. It's not just about telling people what they should think about, it's also understanding where they're coming from. So it's a conversation, and it's a conversation you don't have once, it's something you have many times. And I think I've been really fortunate to have the role that I've been able to kind of carve out, in that it's just such a privilege to talk to people. And I can still remember, you know, I have a very firm view about, obviously having made many embryos, the value of an embryo. I see an embryo as having a potential to be alive, but a life not yet realized. And I went to my very first ever public forum where I got to speak to people who did not share my view. And it was quite challenging, but I'm really glad I went, and I'm glad I listened. And it changed how I thought about my field. It didn't change my views, but it made me think about how I spoke about my views. So I think that kind of reflexive practice is really also really important. But I think it's being available and making yourself available, and stepping into perhaps, you know, scary or difficult challenging conversations.
Yeah, thank you. And just on the back of how, I guess, thorny, as you put it, stem cell research and things can be, Lily has a question for Susie about, you know, how this influences your research. So public perception and policy, how does this all influence your capacity to conduct your research, Susie?
I think it's a really good question. And on the back of what Megan just spoke about, whilst I haven't even been involved in that sort of thorny issue, I think COVID raised its own thorny issue for all of us, in terms of people coming with different ideas and different understandings and different thoughts than perhaps what one might have expected. And so that was very real for us. We were helping make a COVID vaccine very early on in the pandemic with UQ, and it was part of the media and everyone would have heard about that clamp vaccine. But whilst we were doing that, we also had people at our organisation who didn't believe in vaccines and didn't believe in COVID vaccinations and had some interesting thoughts. And so I really prescribe to Megan's, you know, thoughts on this, in that you have to remain curious. You have to hold your own assumptions about what people are going to think and what people who've been trained in science are going to think lightly, because they don't always. And we don't have the right to tell other people how they should think, just like they don't have the right to tell us how we should think. And by actually listening and remaining curious and asking real questions with curiosity to understand is how we move forward. You don't always have to agree, but you have to get to a common place. And we really worked through that quite a bit through the COVID pandemic and through being involved in making vaccines for COVID.
Yeah, reaching compromise is so important. Megan, what are some of the challenges that you've faced? Because when it comes to advancing or progressing stem cell legislation here in Australia, and I believe you've been involved with it internationally as well, you might be facing a lot of backlash, or you might be facing some of those fears. And you know, Susie was chatting about, like with COVID, for example, you know, there are a whole bunch of people who might not share your beliefs, and you have to kind of work out how to formulate legislation around that. So what are the challenges that you faced when wanting to progress?
Well, it's been really interesting. I've been sort of lucky to be involved in a couple of different sort of areas of legislation, and neither of which are actually called specifically stem cell, but they touch on stem cell research. So I suppose I started my sort of policy work around the law that governs the use of human embryos in research, and where I and others were arguing for a change of that law, and I've been involved in several different iterations. And that was really quite tough, because there was a a very sort of vocal opposition to using embryos in research, and yet I think the argument we used, which was, I think, compelling and effective, was that these embryos would have been thrown out. They would have been destroyed anyway, but they could be used in research in this very kind of narrow, defined manner that had appropriate regulatory oversight. So I felt like we could argue a very strong case that I could believe in that was really around scientific justification. So where perhaps the answer had already been obtained, you couldn't really warrant doing the research, but where there were questions remaining and this type of research could elucidate those, then that would be appropriate. However, the other policy area that I became very involved in was quite different, and I'll come back to how they're interrelated. But this was around what I and colleagues saw as a gap in the legislation around therapeutic goods. So we have the TGA and the Therapeutic Goods Act in Australia that governs the evaluation and approval release of therapeutic products. And it was clear that in Australia we had a capacity, basically a gap where a registered doctor could basically produce any stem cell product and release that to the market if the cells were from the patient. And we were very concerned about the open-endedness of that and the lack of scientific justification. But it took a long time to get that law changed. And a lot of it was because we could see potential problems, but we hadn't yet had a problem. And perhaps just misinformation and people coming to financial harm wasn't sufficient initially. So that was really quite challenging. And why I mentioned that they were interrelated is I talked about the promise as a justification for perhaps use of embryos in research, that if we could understand how cells function more through the use of human embryonic stem cells, then potentially we could develop new therapeutics. And of course, the clinics that I was critical of and the individuals who were perhaps enthusiastic and shared our enthusiasm about stem cell biology, but were not going through what we would see as the appropriate clinical evaluation and manufacturing steps. And those two processes those two policy experiences were really different for me. And I think really quite challenging in different ways. But again, what was enabled me to perhaps have an impact in this space was, again, bringing different stakeholders together. So in both cases, I worked with very closely with clinician researchers, but also advocates, community advocates, consumers, their families, people who are affected and living with various conditions. So it's that kind of holistic network that you need to develop to, I think, have an impact.
Yeah, and both of you have talked about making an impact, and you've both worked across both academia and industry, and perhaps they're often seen as something that are a little bit separate, yet both of you have managed to sort of go between. So Megan, you've worked for a biotech company and you've sort of come back into academia, and Susie, you're working with CSIRO, but also have a position at Monash University. So do you find the two very different in terms of academia and industry if you do want to be making an impact in the world in biomedicine? Maybe Susie, we'll start with you.
Sure. I do think the two are quite different. I feel CSIRO is probably something in the middle. We're considered industry, but we probably are we fill that gap between academia and true industry. I feel that being different is fine too, by the way. I don't think that any one organisation should try to be everything. So there is a place for basic research. There's a place for true quest of knowledge for the sake of that knowledge. Although I personally feel that one should be targeting where you're trying to take that research. Not everything has to be done to translate it. And I do worry that with the added pressure for translation, that we're seeing our academic partners trying to take things too far without a true understanding of things such as manufacturability and translatability. So we spend a lot of time educating the people we work with about manufacturability. And when I raise that, people go, well, what does that even mean? And what that means is the ability for obviously what you're working on to be manufactured. Now, it sounds simple, but I always like to put it in the context that if I'm having 4 people over for a steak dinner, I can cook 4 steaks and have them on the table and serve up a meal all at once. But send 400 or 4,000 people over to my house for a steak dinner, and I'm not very good at getting them all ready and all on the table at once. That's because the process for me, cooking steak in my kitchen, is not manufacturable. It works fine at a lab scale, but it's never going to make it into the reality of it in the manufacturing. So where CSIRO comes into that is in the middle, where we actually develop processes and ways of actually making it manufacturable. And we help our academic partners take it to that link into industry. I think that's really important because, again, industry doesn't do a lot of their own basic research. So they don't often necessarily always have those initial aha moments and findings and inventions. But our academics don't have to take those inventions all the way through. And the balance of when to do the handover and doing what you're good at is really important. We can't all be experts at absolutely everything. So stick to what you're really a good expert at and do that really well. And don't feel you've got to hang on to it for grim death, because you don't. And I feel that's where we lose our opportunities to actually translate well, is when it's either handed over too early or it's hung on to too late. And there's a really fine balance there.
Yeah, and it's great that there are teams like yours that can sort of support people take their work further without having that sort of expertise. Like, that's where you come in, right? So Megan, we might circle back to you in a moment, but I just want to ask you, Susie, while we're on this, like, what's actually involved in setting up new facilities and thinking about how do we take things to the next level to better support people in the future? If we don't have these capabilities now, how do we build them?
So you're touching on a topic that's very front of mind in Australia at the moment, as you know, since circle back to COVID, I hate to keep raising it, but mRNA vaccines. And there's a topic that's, across the country right at the moment. mRNA technologies, therapeutics, because it's not going to be just vaccines. And how do we build facilities? How many facilities should we build? Where should we build the facilities? And here's the plus and the minus of working in this country of ours, where, we end up having these state wars around every state wants to do everything. I think working for an organisation like CSIRO is great because we can step back and say the country is not big enough for this kind of thing. And when we're talking about building facilities and what facilities we should have, we need to look across the entirety of the country. We're a small country. In fact, we're about the size of Texas in terms of population. So if you're thinking about a clinical trial, we're a really good little first phase testing ground for something that's going to go to something like the size of America. And so if we're talking about building facilities, we need to make sure that the facilities that we're going to try and build are going to be sustainable into the future and aren't just going to turn into white elephant because of a fad of now. And I feel we do assess that a lot when we're looking about building in new capabilities. At CSIRO, we're not going to build capabilities if they're already out there somewhere else. Our job is to actually grow the ecosystem or the biomedical ecosystem. And so if there's a company out there that does something really well, we're not going to do it as well and compete because we're trying to grow that system. So them doing it really well is success for us. Where we'll look at building a facility or bringing in new capability is when it's not already out there in the ecosystem. And in fact, it's a gap that's stopping things progress through that ecosystem into translation and being manufactured. So a good example of that is the National Vaccine and Therapeutics Laboratory that we opened late last year, where we can now make vaccines and therapeutics for phase 1 clinical trials in this country. And we're well positioned to do this because, as I mentioned before, we can work with academics to take and assess where they're at and then look at their processes, develop them, make it scalable, make it manufacturable, and produce a product for their phase 1 clinical trial, and then tech transfer it to a manufacturer who'll go on and then make it for them in the longer term. There wasn't other people playing in that space. There weren't other facilities who were doing that. So it was a good opportunity for us to do that. And I think that's really important as we move into this mRNA space, that we don't open too many facilities that in 10 years aren't going to be utilised. There are only so many dollars in the ecosystem in this country for facilities and infrastructure and building capability. We need to use it wisely to optimally ensure that manufacturing or enabling manufacturing in this space is at best throughout the country.
Thank you for sort of opening our eyes to all of this. And I do want to come back to the future and what both of your hopes are for the future as leaders in the field. But Megan, the question before was about sort of that move, because you went from academia to industry and back. How was that for you as a career change?
Well, I mean, it was, I suppose, a little challenging, really. I mean, I think, and I was going to talk about this later, if it was possible, but I think this issue of creating your own niche or an opportunity for yourself, this is really what I was trying to do was quite different. And as Susie mentioned, I was going back to the ecosystem that Susie mentioned, because I think I agree with Susie that we have our own strengths, but I do think a little bit of fluidity is good, and it does enrich different workforces. And I think perhaps training and skills development is a perfect example of that. And so for me, I had finished my PhD, worked in a biotech company related to the same people who I'd done my PhD with, which was fabulous. But then when I wanted to come back into academia, I had my sort of seniority wasn't initially recognized. It was by my colleagues who wanted me to come back into academia, but not necessarily by the hierarchy at the university. So that was that took a little bit of convincing and discussion to say that I was coming in at the right level. And I think my advice on that point is that you have to argue and kind of put a value proposition about yourself in some of these situations if you wish to do something that's not conventional. So I agree with Susie that I think we need this rich ecosystem to advance the field, and we each have strengths, and not just in industry and in academia, but also I was thinking about even health economics and these other areas like government policy, who sets the agenda, and how do you work with them, and as you said before, Kat, around science communication. So we're all part of this kind of rich ecosystem, but going between, I think, is possible. Perhaps when you get to a certain seniority, it's more difficult, but I still think we should be trying to change, or at least encourage that at some level. And I do think, looking back, when I try to transition between the fields, it was 15 years or so ago. I can see a big change. And there are different initiatives that can kind of foster that, but it's not simple. And I think it comes back again to our career paths. And if you want to do something that's not conventional, it doesn't mean that you have failed in the conventional sense. It just means you're looking for something different, and you have a different contribution that you want to make, but you'll have to argue for that.
Yeah, I think absolutely knowing your value and knowing that you are wanting to do something different, but that's what you can do is really important. I also
Can
like.
I add
Oh yes, Susie, go for it.
I was just going to build on what Megan said, because it really resonated with me, because I do remember back to when I said I was going to transition to work at CSIRO, and some quite senior people in the academic space told me it was the worst decision, it would ruin my career, and I needed to, stay in academia, publish more, do this, do that. And I stuck to my gut and said, no, I think this is a really good opportunity for me. And I actually think it was the best decision for my career that I made. So, I would completely agree with Megan that there is no norm. There is no one path. And if you're not doing what drives your passion and you're not doing something you love, you'll never be at your best. So it doesn't matter where you find that. You have to keep chasing it. And if it means doing something slightly different, then do it, because no one else can tell you what you're passionate about.
Yeah.
It also might mean that you fail, or you don't not necessarily fail, but you don't get to where you are. You might have to deviate or to kind of morph a little bit. And I think that's okay too. But as Susie said, I think you have to stay true to yourself. I think that's the most, your gut feeling. You've got to honor that.
And as you carve out this sort of niche, as you put it, I really like a way that you phrased it when we chatted earlier. That sort of carving out your own stem cell niche, or can I say differentiating your own?
Oh no, I think I'm self-renewing all the time, Susie. In my own niche. But maybe maybe I do differentiate. I don't know. But I do think it's finding the you need, so to do what I just said, you need to be surrounded by people who support you to do that. And finding those people, I think Lily's asked a question around how can women support other women. I feel I've had support from both men and women, but having a support network, having people around you who, again, take the time to listen to you and to help you articulate your case and your value proposition, that's been invaluable. And, Susie was one of my great colleagues many years ago when we worked together, and somebody who I could go to as a sounding board, as were many others. And you have to develop that kind of that community around, or the I suppose it's more of your niche, really, but the people who are going to support you and who are going to help you get to be where you want, or at least even giving you some critical feedback to say, well, actually, I can kind of see where you're going, but that's not going to fly without X, Y, and Z.
Yeah, I was going to expand Lily's question to people because, I'm sure, there's a great community of people out there, men, women, non-binary people who might be supportive. But I was also going to link in, we're starting to roll with the stem cell puns now, like that idea of growth factors. You need growth factors to help you, right? Susie, did you want to expand on that?
Yeah, I was going to add to that. I was lucky enough to just finish a leadership course for leading the enterprise in CSIRO. And one of the topics we discussed on the last day was about your network. And this really touches on what Megan just said. Your network is a 360 of people that fulfill all the different roles that you need in the way you operate. And I feel it is really important. As Megan points out, there are many, many different types of people that you need. You need the people who are always going to stand by you. You need the people who are going to challenge you and say, actually, maybe that's not going to achieve what you think it's going to achieve. Have you thought about? You need the people who are going to inspire you. And so there's an entire 360 of different types of people. And they don't come in one form. They don't come in one gender. They don't come in one age. They don't come in one skill set. And it's not stagnant either. We need to surround ourselves by people, but in different stages of your life, those people need to come and go. You use them more and less, depending on what you're going through, depending on what you're trying to achieve. But I do think it is really important that we do that. And by doing that, you end up with advocates. And I think Megan would agree with me that having advocates is really helpful when you're trying to get places with your career or try something different where you may not have the runs on the board already and you're trying to actually just branch out. A good example would be for myself. When I first went to CSIRO, I came in as a science leader. I was supposed to do science excellence for 5 years, postdocs, and normal kind of the most academic, I guess you could be within CSIRO. It was fantastic. I loved it. All I had to do was science excellence. Fantastic time of my life. But after that, I really wanted to made the decision that actually I felt I could make a big difference by moving into a leadership role. There were people within CSIRO that questioned whether I'd be able to turn that academic brain off and really turn on a leadership role. In part, they were right. I still have that science-driven academic brain, and like Megan attends meetings at night, I go into the lab at 5:30 in the morning and do science experiments, and you'll never get that out of me. I love it, and I still think about science all the time. That doesn't mean that I couldn't turn my brain to do, leadership as well. So I think that's where your network comes in. You've got to have the people who challenge you, but you've got to have the people who support you. And as Megan says, you've got to go with your gut.
Yeah, I really like that term, advocate, Susie, because I often struggle with mentor, and not because I don't have mentors, but they're informal. I've never really gone up to somebody and go, "Hey, will you be my mentor?" But I can count many people who've been my advocate, and also my supporter, and as Susie said, different roles, my challengers, and they, I suppose, are the people I actually hold dearest. Are the ones who actually have forced me to have refined my argument further, let's say. But I think yeah, I used to call it networking, Susie. Like, I remember somebody very prominent taking me aside saying that was a really poor use of words to kind of talk about that, kind of how important networking was. But for me, it's that really rich, it's a community. It's this kind of fabulous group I have around me. And as Susie said, I don't call them every week or every day or even maybe every year, but I know they're there and I know who to go to, and they give me different things at different times when I need it.
Yeah, I've been calling them cheerleaders, but I do like that term advocate. um, Megan, did anyone support you, or was there a particular program that helped you move from laboratory science into this area of policy? This is a particular question from Isoto. I hope I'm pronouncing your name
Yeah,
correctly.
I
But how does one go about that?
So I saw that question, and it's a great question. I do get this. I have students who ask me this all the time, and I think I don't have a simple answer. For me, it was really an extension of my science. And I think my own interests, that I had an opportunity. I kind of lent into a huge opportunity when I was working in biotech. The company I was working for really wanted to be more involved in some of the policy around the use of human embryos in research. And they said, "Oh, this is the kind of thing you're interested in, isn't it, Megan? Would you like to be involved?" And I said, "Yes." And I kind of really, it was kind of on the job training. I worked with some fantastic industry based professional groups, Oz Biotech being the key one. But I also worked a lot with politicians. So I found this kind of amazing community, actually predominantly of women, who were from different areas, different parties in the political system, but who were all interested in advancing medical research in this area. And that was extremely rich. And I remember, in particular, Kay Patterson, who was then Senator for Victoria and had been formerly a health minister in the Howard government. And she took it on as a private member's bill to see there'd been a review of this law, and a whole lot of recommendations made, but there was no action from the government. But Kay took it on as a private member's bill. But just, I found it so inspiring listening to how the politicians were driving this reform, and then what the scientists could do working with the politicians. That kind of was my on-the-job training, and I absolutely loved it. And again, it was, a little bit of serendipity, being in the right place in the right time with the right skill sets. I was a young woman who'd worked in IVF who also done therapeutic cloning, so I could talk my way around anything to do with cloning. But I also was putting myself out there in a pretty volatile community debate at that time, and I was quite happy to do so. So to answer the question, I think if someone was interested in this area, obviously look for participation with your professional societies. That's a great place to start, to volunteer and to get involved. I think also there are some fantastic courses to do, perhaps at a postgraduate level, that would expose you. And then the classical route into policy, of course, is to do an internship and or a position within government, to take up the opportunity to actually work in government and understand government and how, at its various levels of how it works. So there's many ways to get in there, but again, you have to carve out your own niche, and look at what your skill set is and where you can make a contribution.
And hopefully we have people on this call and who are listening who will be the future advocates and will be informing future policies. So speaking of the future, both of you are very senior in your fields and in your areas, and a lot of people look up to you. So I wanted to get a bit of a sense of what you hope for the future. Both of you, your first love was stem cell research, so we might talk about that first. Susie, what do you hope to see in the next 5 years in terms of stem cell research and where it goes and how it's received?
I guess when we're talking stem cell, I'll go back to my favourite stem cells, which are your bone marrow stem cells. And what I really hope for in the next 5 years is that we'll get gene editing of our bone marrow stem cells in situ or in vivo. So in the body, without having to harvest and put someone through a bone marrow transplant, that we'll get in vivo gene editing to cure some of the diseases or disorders that don't actually necessarily end someone's life, but have a massive impact on their life. So it may be where you don't make a particular factor or something else that has, daily impact on your quality of life. And if we can go in and edit those stem cells in situ and fix that, we'll then have obviously massive positive impacts.
Yeah, thank you. Megan?
And for me, I think the 5-year time frame is a little bit narrow for my aspirations for the field, and I'm always very wary of that
10
time.
years.
But what I hope we will see, and what I think we will see, is progress towards cellular replacement therapies, but only for a very narrow application. So I'm not a big fan of the kind of magic panacea for stem cell biology and for for cell-based therapies. But I do think in specific conditions where there is a target group of cells that are affected, where we already know how to make those from a pluripotent source, for example, and make the right cells in the laboratory, translating that knowledge into a product that can be delivered at the right time in the right number to patients who can benefit from them. I hope that's what we'll see. And here I'm watching with, as many people are, with great interest, the progress that are being made in the sort of this next generation Parkinson's cell-based therapies, as well as a continuous interest, obviously, in diabetes. So conditions where there's one particular type of cell that's affected. The idea of being able to make replacement organs and to do more curative work, as Susie says, like life-saving work like that, I think is much more distant, if ever, just because of the complexity. But again, I'm hopeful that we'll make progress, but whether we'll have an actual proven, safe and effective therapy in 5 years, I think we'll still be in the research stage. And that's always a really hard message to take out into the community, because we've heard about the promise of stem cell science for so long. But I think it's a comment and a concept that we need to get familiar with. One of my bugbears in translational science is that there's this kind of almost simplistic view that you make a discovery and you translate it, and it takes 5 years, 10 years, whatever. But it's much more complex than that. And I think, we need to obviously keep doing translational research, but be prepared to have to go back to the drawing board. So be prepared for that iterative loop, that the research actually might raise more questions than it provides answers. But that's not a bad thing if we want safe and effective medicines. I don't want to see a lot of junk in the marketplace that's actually not benefiting anybody, but costing the community a lot of money. So I can say that as somebody who's not hasn't got all their I'm not living with a condition that could be perhaps affected or improved. So I'm very sympathetic and sensitive to that position. But equally, I think we need to stand by evidence-based medicine and not allow unproven and untried and untested products on the marketplace.
Yeah, thank you. And, it's nice to be hopeful, but as you talk about, like, sort of understanding the limitations and actually where we're at, and Susie, you're talking about sort of acknowledging our capabilities and not trying to stretch beyond that. So just on that, you've established the National Vaccine and Therapeutics Laboratory, and you're really thinking about how you can better support people who are trying to make way in biomedicine. What are your ambitions for this particular laboratory?
My hope for the laboratory is that we will enable the testing of new vaccines and therapeutics within Australia. So Australia is a really great location to do phase 1 clinical trials for a number of different reasons. We're set up differently to the US and to Europe in the way our phase 1s are conducted. That has, of course, many benefits. It does have some risks, and Megan kind of alluded to them before. But to be able to do that, we need to have available to our researchers a path that is relatively easy to follow and is actually achievable financially and in a time frame. I think I agree with Megan. We need to fail early and fail, be prepared to fail early and fail fast. Failing at a phase 1 clinical trial stage is normal. The vast majority of things will fail at that stage. And that's heartbreaking if you've put, 10, 15, 20 years of research into getting to there. But as Megan points out, it's even worse to go further. I feel that if we have a variety of different therapeutics and vaccines coming through this laboratory, and a good example of the space that we play in that's actually unique and really developing is where biology and chemistry meet together. And that's it, like bioconjugation, it's called. And a good example is a theranostic. So for those that aren't aware, a theranostic is when you have a diagnostic and a therapeutic that are linked. They're the same, one and the same thing. So you'll get a biologic, usually an antibody, and you chemically conjugate a diagnostic, and it's often a radioactive, so you can use it to diagnose, and then a different radioactive that you conjugate to actually treat. And we just recently made the first one of those has gone into a phase 1 clinical trial. It was in a collaboration with UQ, and it's in a ovarian cancer setting. So to me, that's really exciting. It's a new space that's rapidly developing, relatively new space. It's certainly new for us, and it's exciting new science, bringing two different disciplines together that has huge opportunities for changing the way that we can translate things and bringing new therapeutics to the marketplace. As with everything else, we need to do it in a way that is optimal, in that not everything's going to succeed, and we've got to be prepared for that. And I think Meg and I would both agree, you actually learn more from things that fail, because when something works well, you don't really sit back and analyze it. I find that in science, when something doesn't work as well as you hoped, you actually spend a lot more time trying to break it down and work out what didn't work and how can you do it better next time. If you succeed at something, it's easy to celebrate and go, oh yeah, that was great, and not actually break down and say, how could we do it better? Mm-hmm. So not everything will succeed, but I really think that this is a great opportunity to see good advancements moving from research into the clinic in this country in the future.
Thank you. I think, no matter where you end up, the people who are on this call, as you go throughout your career, the lesson, I think, one of the lessons from Megan and Susie, don't be afraid to fail, no matter what you do. If you have another burning question, you can pop it in the YouTube comments, because we are wrapping up soon. But Megan, I think a question that's sort of potentially more immediate, you're working with a lot of policy development and advocacy and developing educational resources as well. Is there something that you believe right now is lacking that you are trying your darndest to get out there?
Well, so I sort of hinted at it before, but I'm still. So we've done a lot of work in this space as a scientific community. We've created a lot of resources. I've certainly co-authored a lot of those, and they're great and they're useful. But what they're lacking is, I think, a little bit more research around what do people really want to know, and how do they want to know it. So a lot of the work that I've done to date has been, I suppose, putting out what I think people want to know. But a lot of the research that I'm now doing is trying to understand more about how people want to get information, and where they're taking information from at the moment, and are they even coming to the websites that I've helped build, for example. I think the other aspect of that is that so much of what I've done is in English, and we're in a very multicultural community. And so I really I'm looking forward to working with some colleagues on developing some resources that can be translated more easily into other languages, and not losing sight of that. I think some of the messaging that we want to put out there around perhaps understanding what is an approved therapeutic product and what is perhaps bogus or being perhaps the science is misappropriated, trying to make it very clear what you should be looking for. We could do this in many other languages, and I think that would be an enormous contribution to helping people make a better informed choice. And then the other areas, that's all around kind of I suppose, perceived and real access to participation in clinical trials, but also to approved treatments, and then avoiding those that are yet to be approved. But I think the other really interesting policy issue in the stem cell space is this kind of almost like a 360 from the beginning of my career, where we can now take cells from a tissue, from blood sample, and make stem cells from those, and then using those stem cells make models that look like human embryos. And what we're seeing, and we're seeing this advancing at such a rapid rate, is those models are becoming closer and closer to actual sperm egg embryos in terms of their makeup, their cellular makeup, and potentially their what they could develop into, their developmental potential. So I find this a really challenging area, because I think I'm not sure the community are completely in sync with where the science is going, and I'm really curious to see how existing laws and regulations overlay or should overlay this area. And depending on where you are in the world, and depending on how an embryo is defined, you either have a very defined regulatory system, a governance structure, or you don't. And I think that discrepancy is something that's going to be really challenging for the field. So at an international level, that's something we're looking at very, very closely. And my position is it should be not necessarily what kind of day the culture is, but what the culture perhaps represents, and what the research associated with the experiment is trying to address. So I've always been really interested in that justification. What is the scientific justification for doing it? And I think if you can make a justification, particularly when it might be a one-off, or at least a contained area, that's very different to saying, okay, let's just do everything. Who cares what researchers are doing? So I think communicating that, defining that, is going to be a big part of my work going forward for the next 5 or 10 years.
You've got your work cut out for you. We have a lot of younger people who are students or earlier in their careers, a lot of girls, a lot of non-binary people as well. Just to wrap up, Megan and Susie, I was wondering if you could please give me, in 60 seconds or less, I've got a timer here, just roughly 60 seconds, what is the one piece of advice that you would give to people to take away if they want to forge a career in biomedicine? Maybe Susie, we'll start with you.
Sure. My advice would be stay truly curious. So that to me means hold your assumptions around anything lightly, and don't be afraid to have been wrong and modify what you believe in something, or what you think you're best at, or where you think something is going. Try different things. So never have a fixated career path. Be open to new directions. Be open to being uncomfortable and, on the edge of your expertise to learn new things. Never think that you're going to stay in the same space for the entirety of your career. Never think you're too old to learn anything, because you never are. And if you've lost the passion for what you're doing, if you're not super excited to get up and go to work and tackle what's on for the day, then step back and say, it's time for change. Do something different. So really, this is such a fantastic field to work in. There are so many opportunities. Just go for it.
Mm. Well, I don't know how to top that, Susie. You said everything I was going to say. So my catchphrase was going to be just do it. And I think the only thing I would add to Susie's excellent sort of advice there would be find those champions or those advocates that we mentioned earlier. Find yours. Susie and I have been able to cultivate ours over many, many years. You need to do the same thing. So take it seriously. People who you feel like are impeding your career, just step around them and find others. They'll be there. Particularly, as Susie said, if you maintain that curiosity, your enthusiasm, and a degree of buoyancy where you are, you're not just blindly going forward and pretending you have all the solutions and all the, I don't know, the answers, but really taking a step back, thinking, talking, listening to people around you. And I'm sure you'll have a very rich career, because as Susie said, it's a fantastic space to work in. And I think in Australia it is small, but that is one of its great strengths, is that you can establish this incredible network, look beyond our shores as well. So you don't have to necessarily always travel overseas to go and work as a postdoc, but you can form that kind of advocacy group that we were talking about with international colleagues, which is what I've done. And that's been incredibly rich. So I just think, just do it.
All right, everyone, just go, just do it. Thank you so much, Megan and Susie, for sharing your experiences and for sharing your advice as well. I know you can't see anyone but me, but I'm going to give you a massive clap on everyone's behalf. And I'm sure everyone's sort of silently clapping along. Thank you very much for sharing. So everyone, you've been listening to Professors Megan Munsie and Professor Susie Nilsson. And I think both of them have taught us lots of things, like find your niche, carve your niche, find the community and the advocates for you, keep learning, listening, and failure is part of that. And, we should all just embrace that. But I think, learning from you both, you've already accomplished so much, and just like stem cells, you have so much potential. To put
Well
that one in there. Thank you, everyone. You can continue the conversation on Twitter. We're at Conversci, and you can also use the hashtag Women in Biomed to keep going with this conversation. Also, you'll receive an email this afternoon asking you to complete a survey. And if you could please do that, we very much appreciate your feedback as we think about how we can plan future events like this. So thank you very much to you all for coming along. Thank you for those of you who submitted questions as well. Thank you to Megan and Susie. Thanks to Luana and Colin behind the scenes who we can't see. But also, thank you to the sponsors as well. So as I wave you off and bid you farewell, you can see the sponsors up here. So thanks very much for everyone who joined today, and we'll see you next time.